They built out physical practices on corporate campuses like Facebook and Microsoft and Amazon fulfillment centers and things like that. And so they basically outsourced primary care. But what that did was, for Facebook's campus, there's 30,000 employees. There's 100 doctor practice on that campus taking care of those 30,000 people. That significantly changes the care patterns. To me, it's like the most elegant healthcare experience you've seen. There's a lot of these things that exist kind of in these little utopias or behind closed doors in healthcare. I mean, there's millions of people that are getting healthcare in a very futuristic way. It's just not the traditional, like, oh, I get my care from Aetna or whatever.
Welcome to How I Doctor, where we're bringing joy back to medicine. Today, I am thrilled to welcome Dr. Jay Parkinson. You might know Jay as one of the earliest innovators in virtual primary care, founding Sherpa and Hello Health. But I remember when he made headlines saying he would be a one-man show doing internet-enabled house calls in Brooklyn for pediatrics in 2007. Jay is seemingly always way ahead of his time. After building design-driven care experiences for 2 decades, he's now back as the founder of Automate.Clinic, a medical practice where physicians train and fine-tune AI models to ensure clinical-grade accuracy. Welcome, Jay Parkinson, to the show.
Thanks so much for having me, Graham. Can't wait to talk.
I cannot believe we actually have not met before. I've been a massive fan. I remember you launching this thing in 2007. I was, I think, a year away from finishing med school and just thought, like, this guy is crazy. Like, I was like both also jealous, but also I was like, he's crazy. He's just going to, like, how will people find him? Like, you've always just been so ahead of your time in thinking about the way to deliver care. It's really, really amazing.
Hey, thanks for that. Yeah, I mean, part of it is it's crazy, it's naive, but at the same time, you have to be a little crazy, a little naive for, starting cool new things. So, yeah, I think it's one of my superpowers, being a little crazy.
Yeah. I was looking through your great website, Jay, that actually still documents like a lot of the old school clips and stuff. And it was like such a blast from the past of the internet. It almost feels like a different era. I guess it was a different era.
Totally. I mean, that's what's been so amazing about these last 18 years is like, gosh, whenever we started, like, hey, blogging was just turning into a thing. I mean,
yeah, it was still web logging at the time.
The last 18 years have been amazing just because I feel like I've lived so many different lifetimes in so many ways.
Did you always think, okay, I'm going to come up with build my own mousetrap, solve my own problem? Like, was that always in the vision for you? Or was this, the iPhone came out and you had an epiphany? Like, what made you start on a very different path than, honestly, probably 99.9% of physicians, myself included?
I think I was 18 whenever I was like, hey, I'm going to be a doctor. And I think when you're 18, you're just like, you're not that smart. You just don't know what it's actually going to be like in the end. So in a lot of ways, I just always felt lost in med school. I've always been kind of like a weird outsider type. I grew up in like the middle of nowhere, Missouri, and kind of like loved clothes, so that always made me like a, kind of a weirdo everywhere I've been. So I don't know. I guess I've been comfortable just saying like, hey, I'm just going to buck the trend and do something different. So I never knew what I wanted to do in med school, although I enjoyed it, for the most part. But then, yeah, I went to, I did peds because, I'm like, you're either a peds guy or an old person guy. And so knew that answer. And then, preventive medicine was fascinating because it was kind of like, it was the first introduction to like systems thinking. And Peter Pronovost was one of my mentors there. And, the guy that invented the surgical checklist, right? And so he was the one that was like, hey, man, everything's a process. And if you don't design a process, it designs itself. And that's kind of the definition of healthcare.
I mean, you described yourself earlier as crazy. Do you think you're a risk taker? Because like you said, you've like bucked the trend of how almost all of us kind of do medicine. We like follow the path in residency and maybe fellowship, and then we follow the same path as an attending to some degree. We like go work for a group or get employed, and then we just go practice for 30 years.
No, it didn't feel risky at the time. I mean, it felt like, try something. Why not? And so to me, I always think about like, what's the worst thing that could happen? And Like most of the time, like not much. I mean, you just kind of look like an idiot, maybe. Um, but yeah, it didn't really affect me too much. Whenever I was 30 and starting this practice, I was pretty solo. So I didn't have like a partner, kids, a mortgage. So in a lot of ways, I was just like, I felt like life was just starting, like whenever I turned 30, because that's when residency was over. You know, and so I don't know. I was just like, wow, life is big. It can be big. And this was in New York City too. So, it was just like it felt like the biggest place on earth from, a guy from Missouri.
I mean, I remember you because you made a lot of headlines when you first said you were going to do this in 2007. I think I was probably applying to emergency medicine or about to apply. I remember thinking, oh man, I couldn't do what you were gonna do as an ER doctor, and I was like, "Oh, maybe I should be family practice or pediatrics because like, this guy, seemingly, you had so much control over the way that you, like, designed your practice and lived your life, and, like, that seemed really freeing to me as well."
And that's what it's about. Like for me, I guess I just felt so like constricted by this sort of lack of creativity and freedom that you kind of buy into unknowingly whenever you become a doctor. And so, yeah, it was just, how can I design my life so that I have freedom? And then again, like the iPhone came out the day before my last day of residency. And I was just like, I've always been a dork, and paying attention to like tech.
Fellow dork here. Yeah,
Yeah,
yeah.
right? We're the best. And so that seems interesting to be like, I can go kind of anywhere and do anything and not be constrained to this, like, office or hospital or something like that. So
I just think you're such a good role model, Jay, that, it's okay to like find your own path in medicine. And in fact, you've proven like that you can actually be extremely successful doing so. I think so many of us get like hop on the medicine train when we're like 18 or 19. It's like, okay, here we go with the pre-med requirements and then the MCAT and then the next and then the next and then the boards and then, and we think we have to stay on that train. And you like, yeah, I think it's just really impressive that you have shown an alternative pathway that is successful because I don't think medicine really likes alternative pathways, like at all.
no, yeah, no, they beat that out of us from day one.
18 years later, what do you think you got right about what patients actually want from their doctor?
I think they just want to communicate and be heard. You know, what I think is so fascinating is like healthcare at its core is just communication. It's just basically a couple people talking, sharing data, and making decisions around that. And so, for me, it's just there's so many different ways to communicate. Hopefully, in my career, I've shown people that like, hey, if you can open up different channels of communication, you can accommodate all the different styles of communication that patients have, and doctors. And, the stat that hit me hard and was kind of the impetus for starting a lot of this stuff was like, patients forget 85% of what we say. And so let's turn that around and say, well, I'm 15% good at communicating, you know? So if I write that to you and I'm giving you, a summary, and nowadays with AI summaries and things like that, it's even more fascinating because I don't have to like manually do that. But if I can basically like, be 100% good at communication, fundamentally changes who I am as a doctor.
If medicine is fundamentally two people in a room or on a text thread or communicating in however way they're communicating, what of the rest of the system needs to stay, like shouldn't get cut? And what of the rest of it is fat that can be chopped or simplified or removed from that core relationship?
Yeah, I mean, I think you can chop a lot of physical visits. I mean, I would say almost 80% of them. If everybody had one simple place to go to start their care journey, you can get really surgical on how you deliver care because you can say, okay, now I have an understanding of what's going on with you. I'm going to loop in this person into this thread. And now you're going to talk to this expert, right? Or, hey, you need to go immediately to the ER or urgent care center, or, maybe you just need to go to a retail clinic or something like that. So it's just, that's what's so fascinating, the promise. Whenever you think about like what Uber did and what Google did and all the others, they gave people one simple place to go to like search for something, one simple place to get a taxi, and like that just unlocks a whole new way to do things. Healthcare hasn't been good at like figuring out that one simple place for folks. It's been just like this kind of point solution.
Why do you think that is? Because what I would think it's supposed to be primary care. I mean, primary care obviously can't handle everything, but I think in other countries it handles probably more than in the United States. Why do you think healthcare hasn't figured that out? Is it just the payment model doesn't make sense for that?
Yeah, I think so. But I think it also goes back to the fact that like creativity is beaten out of us. Doing something different is beaten out of us from day one. So I just would love to see doctors sort of lead by, and I think we're starting to see that now. I think there's a huge entrepreneurship sort of movement amongst the younger generation of doctors questioning. And I think that's a beautiful thing to see.
I am seeing just a whole new wave of physician entrepreneurs and I don't like the term, but like influencers, like people trying to make sense of the world in a slightly different way or give their own take on it. There's this guy, Preston Alexander, on LinkedIn, and he posted one day, he said, like, what's the worst that could happen? You're still a doctor. Like, if your thing doesn't work out, just go back to seeing patients all day. Like, you've still got a really good, lucrative, safe career that you can go back to. It's all right. Hey, doctors, AI isn't coming, it's already here. Whether it's scribes, risk prediction, or chatbots, AI is reshaping medicine right now. And that's exactly why I created the AI Secrets for Clinicians webinar. Along with my friend and Valdar Health founder, Dr. Sarah Gebauer, we compiled a practical guide featuring a roundup of the best tools, prompting tips, and educational resources for all clinicians to get started with AI. This is the starting point. You need to learn how to use AI safely, ask the right questions, and take the lead on incorporating this new technology into your practice. Visit offcall.com/AI guide. That's offcall.com/AIGUIDE to get started. Thanks. Jay, what do you think employers or payers, companies get wrong about primary care or delivering primary care?
I think most employers, their hands are tied. It's hard for most employers to build out a primary care, service. So they have to contract with like, the insurers or a local DPC or something like that. And, I worked at Crossover Health and they were fascinating because, they built out physical practices on corporate campuses like Facebook and, Microsoft and Amazon fulfillment centers and things like that. And so they basically outsourced primary care. But what that did was, for Facebook's campus, there's 30,000 employees. There's 100 doctor practice on that campus taking care of those 30,000 people. That significantly changes the care patterns in their population because, hey, that's where all those Facebookers know where to go, to get care. And again, it's the front door that's very clear.
At Crossover Health, what types of things did that change in the way that Facebook Meta employees use their healthcare services?
To me, it's like the most elegant healthcare experience you've seen. There's a lot of these things that exist kind of in these little utopias or behind closed doors in healthcare. I mean, there's millions of people that are getting healthcare in a very futuristic way. It's just not the traditional, like, oh, I get my care from Aetna or whatever, or a local hospital system. It's really like this employer driven plans that they're just hard to set up. Crossover was interesting. I mean, my job was basically to say, okay, how do we build a hybrid care model so that prior to like me joining Crossover, you had to go into a physical center to get care. And Scott and I, the CEO, just theorized one day. It's like, well, what if you could use those as confirmatory centers? Instead of, oh, this is the place you go. So that changes everything for people. Again, it's just makes things so easy. And 80% of those visits just don't need to happen. They can just be done online.
How do you establish and maintain that trust when I think there's some part of the physical exam or the in person nature of care is partially to build trust with the patient. Is it really just a matter of you, working to gain my trust over Zoom or something as well? Do you think that's the same experience?
I think as long as a provider adds value to your life and treats you with respect and honesty about what they can and can't do, it really helped me understand that like a doctor's job is not to treat and is not always to treat you. It's to just shepherd you, right? And so, you know, I think that's really important to just be honest with patients. And but the most important thing is like the patient needs to understand that you're project managing their whole situation. You're not treating them all the time. And I think that's really important. That's kind of everything. As long as you're adding value to their lives in the form of communication and navigation.
Where did all these insights come from? Did you know this stuff all in residency? Was this stuff you figured out just along the way when you opened your original practice? Because I think that a lot of these things are not super obvious to a lot of people. Also, because in medicine, we don't teach things that way either.
I always thought of everything as a process, So whenever I designed that, like one of my Hello Health, for example, I just basically wrote down the process of traditionally going to a doctor, and it's a very linear process. Pick up the phone, call. Hopefully somebody answers. Nobody answers. Get a call back. And so you just write all this stuff down, and you can basically say, okay, how can I just like remove this step? So that's kind of always what I did. It's just design principles, really.
I mean, you're almost describing like a Kaizen event or a Toyota Lean thing where you just process map and like, does this step add value? Nope. Well, then it's got to go.
Totally. And that was that stuff that came from my understanding of like, Six Sigma and Lean and all that stuff came from my residency at Hopkins. Because again, it was just all about like systems thinking, systems design, which, it's sad because preventive medicine is one of the 29 specialties, but only like 100 docs go through it per year. And, it's kind of a misnomer. And I feel like in a lot of ways it should be, if tech were enabled in preventive medicine, that would be the path that most of us should go down.
Tell me more. Why do you say that?
Well, it's very old school in a sense. Like it's public health, kind of training. Folks leave and become the commissioner of a public health in like some Florida county or something like that. And so that's great, but at the same time, whenever you think about what we're doing and with technology, it's often not one-on-one relationships. It's how do I take care of a population?
Jay, do you think a pediatrics resident graduating this year, I mean, could they go do what you did in 2007? Just hang up a virtual shingle and say, I'm open for business? Or like, is the world too different now that it's like, has it gotten easier with technology or harder with the healthcare system to do what you did almost 20 years ago?
Like my whole career is just serendipity. And also it was like being prepared in a lot of ways. Like I was the health writer for Gotham Est and Gawker.
I remember that. Yeah. Yeah.
Yeah. So, I mean, they knew who I was. So then when I hung up that shingle, they blasted it out. They made Gawker wrote 2 articles on me that day. Seth Godin got a hold of it. The Colbert Report got a hold of it. And so it was just kind of like, you can't recreate that. I think it's a different era nowadays. There's just so many doctor influencers now, we were one of the first few on Twitter, right?
Yeah. Yeah.
Yeah.
Yeah, it does feel like a different time that, I mean, truly what you were doing was like mind-blowing, and now it is something that is expected and people wouldn't accept if they couldn't have an online interface with their physician. Jay, I think the other thing that you and I have in common is we care a lot about design. Like I think we both enjoy design. What is it about design that tickles your brain or that you have really prioritized?
Well, when you think about like healthcare, the design bar is very low, especially back then. And so it's a way to stick out, like one of the things that I always like to think about when creating a business, it's like, it's a little bit of an art project. It's like, how can you make this thing super beautiful and talk in a way that like my parents would understand? In healthcare, you just stick out, you know? And so I've always loved beautiful things. It's been my thing. So that's just like the visual side of things. But in terms of like system design, I mean, design is the most efficient means of getting something done. So I just love that stuff.
Yeah, I think everybody deserves beautiful things, and I think it's something that people often don't appreciate in healthcare, like you said, because healthcare is, I think weirdly like thought of as a very utilitarian thing and very transactional. It's very much like you have this disease, I will treat it with this medicine.
And it's sort of engineering or militaristic in its like approach. It goes back to that whole thing where like I never really fit in. And so like, making something beautiful in healthcare was a little bit of the middle finger.
Yeah, I think it all gets back I think originally to like the 1910 Flexner report or whatever, like just a very regimented, hey, I mean, probably at the time it made some decent sense. Like, hey, we got all these people dying of treatable things. Let's build a new system that could handle the treatable things. And now, 100+ years later, and it's like, yeah, we probably needed a new Flexner report like 30 years ago or something at least.
One of the things that I feel needs to exist, one of the things that needs to exist is like the American Patient Association.
Tell me what would they what would they exist? What would they do? What do they exist for? Tell me more.
Well, I mean, the American Hospital Association advocates at the federal level for hospitals and their insurance, right? The American Physician, same thing, right? What do patients want? They want something to be accessible and they want something to be affordable. And we've basically turned over our interests as patients to, those other interest groups that are much more powerful. And at the same time, we're 330, 340 million strong. And, I feel like that needs to exist for the sake of, just the experience as a patient.
One of the things that I think people don't really realize, this is like the dirty secret of medicine. So much of medicine and medical training is what do we say? Supporting the patient while the body heals itself. That like I remember rounding in med school and thinking, what are we actually doing for these people? Oh, we're just kind of stalling, waiting for their kidneys to restart or their sodium to correct itself. And yeah, we're nudging things in the right direction. And yes, do the antibiotics help? Yeah, they probably do. But fundamentally, we're just kind of waiting around for the project to move to the next phase.
Yeah, I mean, my favorite quote around that is like magic doesn't make things happen. It's you got to actually do stuff and you got to structure it. You got to have a team. You got to have tasks. You got to say like, hey, there's a lot of like moving parts here. Let's execute on them. Just as the same way as we're building an app as a team, right? Healthcare doesn't really have that. When you look at an EMR, it's not designed as a project management platform. I kind of wish it was.
Well, perfect segue, Jay. I want to talk with you about your new company. Maybe just describe it, like put it in plain English. What is it? Where'd the vision come from? What's the goal?
Yeah, I'll tell you where the vision came from. I live here in Boulder and just moved here in August, so I'm kind of new. A guy I've been buds with on the internet for a while is a guy named Josh Emdor, and Josh just recently left as the chief medical officer at SteadyMD, right? And Steady's a fascinating company. In a lot of ways, they power the telehealth transactions behind like Roe and Hims and Amazon and things like that. So he recently left, and we've been hanging out a lot, just kind of trying to figure out, well, what's next? He was just talking about how his inbox is getting just blown up by companies being like, hey, can you come and like train my models? You know? And I was like, well, that's interesting. How much are they paying you? And he said a pretty good amount. And I was like, well, that's pretty fascinating. Um, is there a way to kind of create a really structured service that allows companies building AI models to interface with clinicians in an efficient way? and have them interact with AI outputs and really just train, through gold standard creation, through correction, through labeling, through sort of like very surgically targeting AI model deficiencies via synthetic data and sort of analyzing the outputs with those measures. So that's really the point of Automate, is to basically say, hey, AI company, you could hire your own doctors. They're going to be pulled into meetings. They're going to be doing all this other stuff. They're going to be strategically thinking. You need people that are like essentially just doing the work
Yeah.
to make sure these outputs are actually, relatively accurate. And so
And Jay, these are generative AI models, predictive, both, anything?
everything. I mean, it's really early for us. My strategy is like get it out there, get the idea out there, get the conversations going and see where those conversations go. So it's super early.
Walk me through as say I want to be a user of your platform. I'm kind of joining because I want the opportunity to kind of get paid to help a health tech company validate or make sure their model is looks good to an ER doctor or a doctor generally. Is that the concept?
It's interesting. If they want some flexibility in the world, they have telehealth in a lot of ways. That's relatively simple stuff and it doesn't really intellectually challenge you. So that's really the strategy here is to give docs flexibility, intellectual challenge, and just work on something meaningful. They're probably also going to be dorks like me, and so they want to like be part of the cutting edge AI side of things.
Jay, it almost seems like it really fits the, I guess, millennial Gen X, Gen Z vibe of like kind of wanting medicine to be one of the things we do, but not the only thing we do. I think that's a much more common trend in kind of younger physicians that like, oh, we want to be a physician, but we also want to build a company or we want to, we want this to be one thing that we do, but we also are interested in technology or we want to have a say in how AI works or we're curious about other parts of the world that is not just medicine, medicine, medicine for 40 years or until we die or something like that,
Yeah, 100%. It's super fun too because any of the docs that I've ever worked with, that have like, we've hired for our practices, um, it's really hard for docs to kind of see what's going on the inside of building these services. How do you build a company? And so one of the missions here with Automate too is to basically, okay, we've had roughly about 250 docs reach out so far, which is I think awesome. I want this to be almost a class about like how am I trying to build this company? And so, we have this like community that we're building within the platform. Part of this is like, hey, here's the challenge that I'm working through to build out the platform, develop the business, to build out, sort of funding mechanism, that sort of thing. So I want it to be also like an insider class to be like, hey, if you're interested in building, health tech, like join us and I'm going to just be really transparent with how we do things.
Jay, do you have examples of real world needs or what automates customers will be getting? Like, is it that the say the generative AI models, like listeners probably know ChatGPT or Claude or Gemini, is it that those aren't validated to be accurate for doctors, or is it really that they're not correct?
Again, this is really early for us. So, you know, I'm on the fence around whether or not this is going to be a generative thing, or other type of model. Because the generative stuff, I don't know. I think it's hard to make super accurate in domain specific things like healthcare.
Different doctors have different opinions about what the quote unquote right answer is. I mean, I think that may fundamentally always be the challenge of kind of validating a generative model is, you're a pediatrician, I'm an ER doctor. We might have slightly different recommendations on how a parent should treat their kid's fever. It's really hard to get two doctors to agree on stuff. And it's not because doctors are like, we're dumb. It's like there's often not evidence for a lot of this stuff. And we're basing it on what's reasonable or what we think the risk is of something.
It's a fascinating argument because do we give up? Is that a reason to give up? Or do we try to build consensus? You know, what I think is so interesting and is other industries, and I always look at other industries. It's very that I look at healthcare for inspiration to do like the right thing. You know, when you look at self-driving cars, for example, like driving is also really it's almost a wild analogy to how healthcare works, how doctors think. You know, most of the time it's pretty smooth sailing down an interstate. Every once in a while, a deer runs out. You know, and like, what's the right move there? It's saying, hey, guys, we just got a really weird situation. Like, let's put 10 people on this and figure out how these 10 folks will recommend that what we how the car would drive. So I think again, it's looking outside the industry to be like, well, that's not generative. That's the generative model. Um, so it's sort of like to me that's my inspiration.
It almost sounds like you're almost going to be like disrupting this term that I hate, the standard of care. And I think we're trying to move a little bit toward this concept of reasonable practice as a standard.
I think this is more about, and this is why I think it's so fascinating for doctors. I don't think this is about standard use cases. This is about like give us all your weird shit.
Yeah.
you know, and then we're going to analyze it. And it's not just going to be one doctor's opinion. It's going to be more about like, well, like what's the consensus here? And then how do we send that back to the client so that they can, use that sort of structured knowledge.
This is the thing that I tell a lot of people is personally, I think medical training is so good that most of the time I don't need clinical decision support. And there are times that I don't know that I need clinical decision support, and I'm like, I could use it. I didn't realize that it would have been helpful to me. And then there's also times where I'm like, this is the weird shit. I'm like, I have no idea. Like, did I miss this day in med school where these two symptoms came together as one syndrome? So yeah, it's a fascinating idea where it's all the rare stuff. That's I love that.
And yeah, I mean, but that's the stuff that's intellectually challenging. Like
Yeah.
one of the things that like I love about doctors is like we always want to be the smartest person in the room. We always want to prove that we are. And so one of the things that we built out is this thing called rounds. And it's essentially just like if you can imagine a bot that is like the most grueling attending you've ever had, you know, and they're just like hammering you with questions. Like what would that look and feel like and how would you respond? So think of like these edge cases that we're dealing with as more of a conversation you're having with an attending about that case, so that you can capture that like thought process and then send that back to companies.
As my hypothesis is that you're always ahead of everybody else. So I want to ask you about maybe some trends about AI and the future of healthcare as you see them. For a clinician listening today, what concrete steps can they take to constructively learn about AI or, you know, shape the way that AI gets rolled out in medicine?
About a year ago, I was pretty burned out, you know, um, kind of just grinding for 18 years. Um, you know, not even really paying attention to like what was happening in the industry because I was just like, oh my God, there's the 10th competitor in this specific space, be funded, right? Um, but then similar to like, hey, the iPhone came about June 29th, 2007. And, so did Chat GPT at one point, right? So I basically just dove into, exploring every single like generative model out there and engaging with it, and doing everything I could to learn from it. You know, um, and I think that's the best thing. It's almost to treat these models as like a professor, um, while also just kind of like consuming all the great content from, people like yourselves who serve as like the sort of disseminator of big news in the space. But yeah, I mean, someday, I'm sure I want to do some sort of like official course, um, But at the same time, it's almost like, man, this stuff's changing so much. I think you can get a lot of the foundations just by kind of like being super curious.
I completely agree. That was, I think, the my first recommendation in all of our tips and our little guide that we put out for resources for people is, hey, here are some common platforms, generative platforms you can use. Here's their playgrounds. So like, mess around with the temperature. See what happens if you ask it to write a song with a temperature of zero point 0.1 and a temperature of 1 and see how different they are. Try to make it, I've asked people to like try to force it to hallucinate. See what you can do to break it. And then you start to get a sense for like, okay, these are the edges, these are the lines, these are the guardrails. I definitely shouldn't use it in these circumstances where it screws up or it doesn't, it's wildly inaccurate. But here's all the space where I can play with it and start to learn, hey, how can I treat it as the world's best professor or my best intern I've ever had, or the best chief resident who knows immediately what to do, and you can just instantly trust what they're going to tell you about the sign out of the patient or something like that.
Totally, totally. And pay for it. Right. And that's the other
Yeah.
thing. It's like pay for it so that you can create these sort of custom GPTs that you can train so that it's not so positive. For example, it's weird because like if in the early days, you didn't know that it was so positive. You didn't know it was designed to be so positive and to say,
I just thought it was really good.
yeah, or just, yeah, just the smartest guy in the world. It's also just been a savior in a lot of ways for me because like, I think healthcare was getting a little stale for me.
I think that the two things that I really appreciate about my medical training when it comes to AI is one, medicine, I think, teaches you how to learn or how to learn quickly or like kind of get up to speed quickly. And then number two, if you've gone through a residency, you have had to supervise other people. Like just by the nature of being an R2, you are dealing with an intern that doesn't know anything. Or being a third year resident, now you're running an entire team and now you're having to find which information are the pertinent positives and negatives that you need to make sure to tell the attending and cut out all the rest of the garbage that doesn't need to get conveyed. And so it actually gives us a tremendous advantage that we can learn quickly and we know how to supervise. And like, I had to train my intern. In the future, don't tell me about XYZ. I don't care if they have a dog, but make sure to tell me they just had surgery last week.
But at the same time, I'm also just fascinated with how to build a company, you know? And that's been really helpful to me because it's like, gosh, I've raised a bunch of money in my career, VC money, and you built teams. And now it's like, goodness, you need like a third of the team now. And you need really mission critical sort of characters on the team. But as long as each one of them know how to use AI appropriately, I mean, it's a force magnifier for sure.
If you need fewer people on the team, does that have any corollary for the future of medicine or the medical profession or healthcare professionals, healthcare workers in general? Do you think there's going to be need for fewer of us, but all of us to up our game, or more of us, or where do you think things go as AI gets from right now? We're dipping our toes into it, but in 5 years, it'll be everywhere, even in healthcare, I think.
I guess I don't share your enthusiasm with like how much it's going to be in healthcare, you know? I'm always like, we're 15, 20, 30 years behind.
I know. No, I mean, normally I would say 10. So for me, 5 was like a dramatic advancement in healthcare.
But I think it's great at the same time. Like, I think there's a point to being behind the times in that you don't want to do things that could be risky for patients, right? And so the great thing about this is like, I'm super curious about like how engineers are going to start working with AI. What's going to happen in hospitality. I guess like part of being a designer is almost being like an anthropologist and just kind of like looking at the culture and looking at like what's happening based on this, the impact of this technology. And, I mean, I would say in 10 years time, healthcare is going to be a little different.
Well, Mark Cuban, I think, tweeted or blue skied, whatever it is, last week that he feels like there's going to be so much AI video slop everywhere, and there will be so much harder to tell deep fakes and stuff like that, that it'll actually massively drive us back toward face to face meetings, because it'll force us to not even force. We'll want the trust that like, hey, this person I'm talking to on this podcast right now is actually there. It's not an AI avatar of Jay Parkinson.
Have you been paying attention to like what Ping An is doing in China? They do as many or visits that Teladoc does in like a year. They do it in like 2 days. Basically, it's the same company that it's Tencent, right? So it's like WeChat, all that stuff. So everything starts on WeChat over there. So every single healthcare engagement since WeChat kind of like picked up healthcare years ago starts on Ping An, right? And so they have just billions of data points. That's all mostly messaging for a while. And so what they're doing now is interesting because, they're training their entire, AI models on these billions of data points that are like situations, not clinical, like EMR documentation. And then they're like working with kind of celebrity influencer doctors to basically work with them for a month to be like, how do you think about these cases? And they're creating like real avatars around these like celebrity docs. Again, it goes out down, like, I don't look at American healthcare for inspiration. It's like, what's China doing?
Yeah, I just saw ASCO just partnered with Google Vertex on, I think they just kind of took all the ASCO oncology guidelines and like threw them into a big, you know, RAG document architecture. And then now there's a chatbot that can tell you what to do with stage 3, whatever, 2B adenocarcinoma of the lung that has failed their first line treatment of something or other. So
That stuff's fascinating because it's like, guidelines should be actionable.
yeah.
Right. And they should be dynamic, and so I'm excited to see where this goes. To basically transition from like a static guideline to like an interactive kind of micro model.
Well, Jay, if you don't know where it goes, then I don't think any of us will. Jay, it's been a real pleasure. Thank you so much. Great to finally meet you. Where can people find your new company, sign up, learn more about what you're building right now?
Yeah, I mean, automate.clinic is the new company. It's that simple. So yeah, if you're a doc,
go to your web browser. .clinic is a top-level domain name. So just type in automate.clinic and you'll find Jay's new company.
It's that easy.
Wonderful. Well, Jay, thank you. It's been a real pleasure.